Heroin takes nearly 2 lives every day around Chicago. It can be cheaper and easier to get than tobacco or alcohol.
Over the last 5 months, Elizabeth Matthews immersed herself in what is now an epidemic and shows us the drug does not discriminate.
What I'm about to show you is tough, but it is real and it is happening right now. People in your neighborhood are dying for the high.
It starts kind of at your feet, and I get this tingling sensation. To me, it's like a full body orgasm.
That feeling is what she chases 2-3 times a day.
The way the sensation just kind of covers you like a blanket.
That feeling is why her life is turned upside down. That feeling is why thousands of people are dying all around us. We're calling her Susan. She invited us into her world and into her addiction, but didn't want to share her identity. We didn't go looking for her. We were not assigned to the story. We happened upon it and were stunned at what we found and how uneducated we were. You might think of heroin use like you see it in the movies, dark alleyways and warehouses, but that is not what's happening here in Chicago. We talked to a source who gave us a couple of locations. One in a public park, and take a look at this. We even found a needle with the needle pointing out for anybody just to fall into. We are in the middle of Chicago in a public park right next to a school where kids play. We didn't know it, but we had stumbled upon a shooting gallery where addicts go to use shortly after they buy. Needle after needle, small bags likely filled with heroin. Those living around this park know what's happening here and see it on a daily basis.
We walk past people shooting up in the park, but I really don't pay attention to it. I try to look away, but you know, you just see the blood and stuff dripping.
Most connect the drug problem to Chicago's west side. It sits right off the so-called heroin highway, or the Eisenhower. It's gang-infested, high poverty, but it's not just here, it's everywhere. Last year alone, more than 608 people died of heroin-related deaths in Chicago and surrounding counties. Cook County leads the pack with at least 424 deaths. In the collar counties in 2015, we lost someone every 2 days from a heroin overdose.
I've seen someone actually not make it before and actually die from using heroin.
30-year-old Jordan Nicolosi has been using for half his life.
What's the point of fighting it and not using? So I ended up just using because I felt like I was already back at the bottom.
He took us to one spot where he spent time getting high, hidden away from the world, here where they throw out garbage.
This is where they get high to avoid cops seeing them doing what they're doing.
After this interview, he was heading to another round of rehab, but the anticipation of getting clean again haunted him. The first 4 to 5 days of withdrawals are physically grueling.
Diarrhea, nausea, hot and cold flashes, bone cramps, everything. It's something I wouldn't wish on my worst enemy.
The result is always the same, but the temptation to get high overpowers it, and it's easy to satisfy. $10 will get you this, a small bag of heroin, typically 2 or 3 highs. Hand-to-hand transactions take only a few seconds and occur on street corners and residential neighborhoods. Susan says she spends $100 to $150 a day on heroin for her and her partner.
I pour it into the spoon.
Normally, as soon as she buys, she goes home to use.
I try not to heat it too much.
She's only been using for 3 years. Susan repeats this every day at least twice. She'd like to quit.
It's either this or feel sick, so it's not even that good rush that I used to get. Right now, it's just maintaining to not be sick.
These scenes are playing out all around us. It's not just behind closed doors. People are overdosing in public places in the city and in the suburbs. In New Lenox, a man overdosed in a car outside a neighborhood wings restaurant. Overdoses have occurred in a cafe bathroom, in a bike trail in Geneva, in front of a gas station and a pharmacy in Frankfurt, a firehouse in Orland Park, 4 bars, and a gas station in Lake County. DuPage County Coroner Richard Jorgensen says they've found heroin in every town.
My kids told me that they could get heroin anytime they wanted to in the high school.
To say heroin is near us is an understatement. It's here, and it's killing us. Black, white, young, old, in our cities, our suburbs, and in our homes. When it comes to heroin, there is no longer an age of innocence.
There were cornfields here when I was a kid. There's heroin here now.
This drug does not care how old you are. I've had coroners tell me they've seen victims from a 15-year-old all the way to a 73-year-old grandmother. Heroin does not discriminate.
Elizabeth, these folks gave you extreme access to their heroin addiction. Were you at all surprised at how willing they were to share their stories and experiences with you?
At first, absolutely. I had no idea that that they would kind of allow us to talk about this. But everyone we talked to, they wanted us to share their stories. They say how important this is, from the families to the users themselves to law enforcement. They want us to talk about this. They want us to get their stories out there. Just wait until tomorrow night. You'll hear from families. When you have a heroin addiction, it's not just the user that's affected. It's the families. The families are so greatly impacted. And to hear from these families, it's so powerful, but also heartbreaking.
And where can people go if they do want to get some help for their loved one?
On my Facebook page, I have a whole list of resources, websites, phone numbers. Elizabeth Matthews, Fox 32, Chicago.
America's heroin problem is not new, but the gateway to addiction is.
Prescription pain pills are paving the way to rampant heroin use at a pace not seen before.
And as Elizabeth Matthews shows us, it is claiming the lives of children and torturing families.
Finally, we have started the conversation. We have brought this topic into your living room. Yes, it is a hard pill to swallow. We don't want to believe that it's happening, but it is. Just ask these parents.
As horrible as it was finding him the next morning, I am glad that I was the one that found him, because I gave birth to him and I was the one who found him.
His mother describes him as a sweet, loving, compassionate boy who got lost. Heroin found him. Tommy Vannerson died just 6 days before his 23rd birthday in March.
I now have 2 children, and he's missed, and he was so loved.
The 7-year battle, they believe, started with one thing: prescription pills.
When he separated his shoulder in junior high, and he was given Demerol, and he loved it.
Tommy's parents say their son's reaction should have been a red flag.
You send your kids with some money to go get a milkshake and a hamburger at school, and instead they're using it to get high.
Tommy would sneak painkillers from the house, but that supply eventually dried up.
That's when they turn to heroin, because they can buy a packet of heroin for $10. It's cheap, and they're chasing that high.
Mike Young was days away from getting Tommy into treatment. He knows how a relationship with this drug ends.
Lost my dad in 1996 to heroin.
Losing both his father and his little brother to heroin was not enough to stop his own addiction.
I battled addiction for almost 30 years. Institutionalization, incarceration, homelessness, any gamut of everything that you could go through in addiction I went through. And the one last thing I didn't go through was dying.
He works for a Man in Recovery Foundation and helps families and addicts work through addiction. Young brought us to a condo in Schaumburg.
3.5 garbage bags. Oh, they're full of needles.
More than 1,000 needles found inside, 70% of them used.
Every one of these bags is a death.
I would give my life if it meant that I could save hers.
This mother is at her wit's end. Easter Sunday, she found herself having to break into her own condo where her daughter and son-in-law were living and using heroin.
I climbed in through a bedroom window to find the 2 of them here, to find that they had sold their bed, they had sold their kitchen table.
She says her daughter has been using for 3 years. Before her addiction, she had a good job, nice car, and a baby. She sent her daughter and son-in-law to treatment and called Young for help.
I've never seen this. Look at this. Look at these. Here. Full of blood.
The condo looked normal, except 2 rooms, the bedroom and the bathroom.
This is their medicine cabinet. You'll see right here that that's still, and I'll reach in and grab it lightly. This is a full shot that they still have left of heroin in there.
The evidence not just on shelves, in drawers and bags, but splattered up and down the walls.
The blood splatter is when you get a clog on the needle. They'll pop the needle.
In the bedroom, there was no bed, no order, just chaos.
How did we get here? We got here because of this drug.
On the dresser, 11 empty pill bottles. The mom says some with names of people she doesn't know.
When you run this and see that this is a powerful medication at 350 milligrams and you are mixing it with heroin, you're going to kill yourself. You are going to die.
45% of people who used heroin were also addicted to prescription opioid painkillers. In 2014, more people died from legal medications like oxycodone and hydrocodone than heroin. Still, a stigma surrounds heroin users. Young says that is standing in the way of fighting this epidemic.
Stigma, 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 stigma. Not my town, not my son, not my daughter, not my husband, not my wife. No. Your son, your daughter, your husband, your wife.
Addiction is defined medically as a chronic relapsing disease.
If my child had cancer, I wouldn't be afraid to talk about it. So why, when my child is a heroin addict, why shouldn't I talk about it?
A wall in Young's office is quickly filling with faces of fatal overdoses.
They didn't start out like this. They weren't scumbags or whatever people think they are. It's an addiction, it's a disease.
A disease that is taking sons and daughters away from families. They are left over, dealing with the fallout of addiction.
Realize that those are somebody's little babies and sweet boys and sweet girls, and they're not what you might think they are. Treat them as such. They're people who need help.
Parents, if you are worried about your child, these are warning signs for you to look for. Sounds silly, missing spoons from your house or other missing items that they could be taking and selling for money for heroin. Look for long sleeves in the summer, irritability, anger, a change in friends, and reach out if you see any of these signs.
So a lot of people have commented that this is happening all over the state, not just in this community,
Correct.
for example.
All over the nation.
Yes, and we saw that he is helping people, trying to get them into rehab. So does he travel, or where can people get help in other communities?
Yep, reach out to people like Mike Young, a Man in Recovery Foundation. He is based in McHenry County, but they have another office in Naperville, a Man in Recovery with Tim Ryan.
Okay.
But they go all over Chicagoland. You call them in the middle of the night, you want treatment, they will go, they will pick you up, and they will take you to treatment. If you want any information about their organizations, other websites, phone numbers, go on my Facebook page, Elizabeth Matthews, Fox 32 Chicago. Tomorrow night, we're going to explain to you why their job is getting harder. Their job is getting much harder, and why the state is handcuffing them and keeping people out of treatment.
Okay. Elizabeth, thank you.
The road to recovery from a heroin addiction is not easy. Many users will relapse several times.
Not helping is the $25 million that has been slashed from addiction treatment programs. Tonight, Elizabeth Matthews wraps up our series called Dying for the High with the challenge and the hope.
In the past 5 months, we met users wanting to recover, but without help, it's all but impossible. Add to that the state budget crisis that's forcing treatment centers to close one after another. But a small group of committed crusaders are offering hope.
I overdosed. I had an OD. My mother found me in my bedroom upstairs. I guess the paramedics came and they used Narcan, revived me. I don't have any recollection of this.
Jan Pishka's story isn't uncommon. The 30-year-old was introduced to heroin as an undergrad.
I was at Loyola in Chicago, and I was one of the students there that was using.
10 years later, he was close to death, but he got a second chance. Mike Young put him on the road to treatment and recovery.
They need somebody, you know, and that's what we try to provide for them. It's just someone to talk to, someone to come to, somewhere where they know that they're going to get help.
Young spends most of his days with Jason Beatty, both former addicts volunteering for a Man in Recovery Foundation.
The reason why we're reaching out is because we have an opportunity today to provide treatment if he wants to go today.
Helping addicts and their families.
It has to happen this afternoon.
So Mike just got a phone call from a gentleman that wants to go to treatment, doesn't want to go to treatment tomorrow, wants to go right now. When they get these phone calls, they have to jump on this opportunity to try to get these people to go to treatment. They dropped everything. We threw our equipment in the car. We're now following them. Right now we're headed to Racine, Wisconsin.
On this cold March afternoon, they rescued Brett Juergens.
I just went back to hanging out with the same old people.
I didn't know it was you, man.
Young and Juergens know each other from sober meetings.
I'll take you down to Chicago Lake.
That's, yeah.
You're good to go. We already checked. Ready to roll.
Let's roll.
You get a nice, comfortable ride.
They catch up on friends who recently overdosed.
And the thing is that that's what's waiting for you, man. You're no different and no better than anyone else. You're not exempt to the rule of the consequences that come along with this.
Their trip ended at a detox program at Chicago Lakeshore Hospital.
While you're in there for that 5 days, we're trying to get you into long-term residential. Well, the waiting lists are 8 to 10 weeks long. Well, in that 8 to 10 weeks, we're watching people die.
Young now struggles to find enough beds at treatment facilities for clients outside of emergency rooms. Many are closing due to the state budget crisis.
Stop. Stop closing these places. Do something, and do something now. These young men and women in this state and in this nation are dying. It is a generation that is being wiped out by this drug.
You were in there with about 25 guys.
Yeah.
3 have died since.
Yeah.
And how many are doing poorly?
At least half of them.
Jesse Saviola is a recovering heroin addict and lost his home when his treatment center closed.
I think we're owed $6 million.
Lutheran Social Services of Illinois offers addiction recovery options. Since last summer, 43% of their staff is gone. 30 programs have shut down. The result? More than 4,000 users will go untreated.
You come in spiritually broken and just bankrupt, and this place teaches you how to live again.
Halfway through treatment, Kendra DeWitt's inpatient rehab was forced to shut down, leaving her to fear relapse.
It'll come to the forefront and say, you could do this. You could just do one. You could just have one night. And I'm like, shut up. You have to tell it to shut up because it is constantly doing push-ups and telling you to go use.
The powerful addiction tempting users back to the drug and back to scenes like these. A life turned upside down in a suburban bedroom. Police say this is where a 20-year-old woman overdosed.
I can take you to pretty much any town in Lake County, and we can probably find it.
Agencies like the Lake County Gang Task Force are working to make heroin harder to find. $50 and 20 seconds later, half a gram changes hands.
Transaction's done. Target is away eastbound Liberty.
Police tackle dealers while the Drug Enforcement Administration goes after distributors.
Just the other day out in one of the collar counties, we took off, I think, 35 kilograms of heroin.
Fighting alongside the DEA are the volunteers at a Man in Recovery. All former users, they have been to hell and back, surviving jail, overdoses, and a toxic stigma.
Those pieces of garbage that they said we were are out there 24 hours a day, 7 days a week, trying to save lives.
This is a story of education, awareness, information, and recovery. There are success stories, people who turn their lives around and give back.
Sometimes there's not a lot of hope, but that's where you get other people that hope for you.
As long as I have breath in my lungs, I'm going to keep on trying. I have hope. It's the one thing that none of us as addicts in recovery have to let go of is hope. You just got to keep hoping.
Recovery is possible. I have seen it. Just in the past 5 months, I've witnessed users go through treatment and get sober. Remember Jan from my story? He is now in recovery, 106 days clean. Great job, Jan. And guys, more evidence that there is hope out there. Since our series started Monday night, people have reached out to us. They've reached out to me, asking for resources, asking for help. And within hours, we're able to get these people into treatment.